Hi, my name is Cora Taylor, and I'm a pediatric psychologist and assistant professor at Geisinger's Autism and Developmental Medicine Institute in Lewisburg, Pennsylvania. And I'm very excited to be talking to you today about social and pragmatic skills for school-aged children. I'll just start off with a couple of disclosures. So I do receive funding and salary support from the NIH, from the All One Foundation, as well as from the Simons Foundation. To start talking a little bit about what my goals are for the presentation today, I'm hoping to help the audience better understand what causes social skill deficits and why we see that in some of our children and how that relates to their developmental or behavioral diagnosis. I also hope to help you identify what are some appropriate strategies to assess for social skills or pragmatic skill deficits, and then how to use that information to identify appropriate intervention strategies for your child. And I'll spend a little bit of time talking about some common intervention strategies that you can work with your school or your child's team with to help build social skills. So when I started this presentation, I spent a lot of time trying to find a definition for what are social and pragmatic skills. And I found it hard to find a definition initially that I liked, but eventually landed on this one. I like this definition in particular for a few reasons, because it doesn't just talk about social skills as being an ability to interact with others, but also talks a little bit about the importance of context, and also, specifically states that social skills are learned abilities. And I think that's important to remember, because even though we don't have a curriculum for them for every child in school like we do for reading or math, they are things that we learn. And most of us learn them through something that educators often call the hidden curriculum. And the hidden curriculum are unwritten lessons or rules that we learn as part of being part of a culture or being part of a society. And nobody ever gives you necessarily direct instruction about those things. We learn them from a variety of teachers, and teachers in this context could be peers. They teach us about social skills and what the hidden curriculum is. We also learn about these from our parents, from people we interact with on a regular basis. We may also learn them from actual teachers, although again, we're not getting that same kind of direct instruction that we get from teachers about social skills as we would with other academic skills. Sometimes things that we learn through the hidden curriculum may be positive or negative, and it includes learning appropriate social behavior and inappropriate social behavior. So for example, being manipulative is something that we could learn through the hidden curriculum, and that is a social behavior, but it's an inappropriate social behavior. But we also want our children to learn through the hidden curriculum what is appropriate behavior and how to learn that behavior. So in our children with developmental disabilities and developmental delays, sometimes we find that they are not naturally accessing the hidden curriculum. So they might not be learning these hidden lessons the same way that other children are. I think a good example of the hidden curriculum is elevator etiquette, if you need an example. So when you go on into an elevator, if there's no one else there, I usually go and just stand by the buttons because that's where I need to be. But if somebody else gets on the elevator, I generally step back towards the back corner. Now, nobody ever taught me to do that, or no one ever specifically told me if somebody else is on the elevator with you, you should try to give them personal space. I just learned that through the hidden curriculum. I learned that through watching what other people did, from watching what my parents do, from how I was expected to give people personal space in other environments, especially if those people were people who were unfamiliar to me. So we think of social skill deficits in some of our kids with developmental delays as being unable to access or not retaining information that others are retaining and learning from the hidden curriculum. So why does this happen? Why do some children seem to miss these lessons that are supposed to be part of education? So some individuals might have just less awareness of what's going on around them. Even if they are aware of other people, they might just be watching them less and watching what other individuals do in certain situations, and then integrating that information into how they behave or act. They might also have less practice with other peers compared to other typically developing children. And I'll get into some of the reasons as to why some of our kids might have less practice with the hidden curriculum. But overall, one of the important things to think about, and especially as it relates to your child's diagnoses, is this a skill deficit, so they're not accessing the hidden curriculum, or is something interfering with their ability to access the hidden curriculum or to use the information that they're learning? And how does that diagnosis impact their ability to engage in the hidden curriculum? So what I'd like to do is go through a few different developmental diagnoses that impact a child's ability to engage in positive social behavior, and talk a little bit about what underlies those problems or what might be causing some of the issues that you see. So first, the one that many people think of when you think of social difficulties is autism. Autism is not the only condition in which we will see children have problem with social skills, as I'll cover some of those next, but I'll start with autism because autism has social communication difficulties as a core feature. And these are directly from the Diagnostic and Statistical Manual that psychologists and psychiatrists use to diagnose autism. So some of the deficit areas that we'll see include difficulty with social emotional reciprocity, difficulty with nonverbal communication, and difficulty understanding relationships, as well as the presence of what we call restricted interests or repetitive behaviors. So how can some of these deficits impact our child's ability to communicate and engage in social interaction? So many of our children with autism present with a speech delay, as well as difficulty with understanding nonverbal communication. That can be both using nonverbal communication, but also understanding and responding to nonverbal communication, like facial expressions. Some individuals with autism might be less motivated by social interactions, but important to note that many individuals with autism might be motivated to have social interactions, but they aren't sure how to proceed. Or they might know step one, but they're not sure what to do next or how to follow up. Or they might not realize that something is expected or required, or they might misinterpret the words or actions of others. To that end, difficulty with what I would consider to be nuanced communication, so things like sarcasm, and as well the presence and intensity of restricted interests or repetitive behaviors might make it more difficult for them to connect with others, and that they might have interests that many other people are not interested in, or maybe perhaps not interested in engaging with and talking about. And on the other hand, perhaps having interest in certain things that are so intense that it becomes problematic for them to talk about or engage in anything but that one thing. Switching gears a little bit about ADHD. So again, I pulled these symptoms directly from the Diagnostic Manual for diagnosing ADHD, and I picked out a handful of things that are symptoms of ADHD that can definitely impact your ability to engage with others. So inattention, seeming like they don't listen, having a hard time staying on one activity or topic, losing things and being forgetful. And then for hyperactivity and impulsivity type symptoms, excessive interrupting or intruding on others, talking nonstop, running and climbing, and an inability to be quiet. So they can't have a hard time changing their behavior to change to certain contexts because they're very hyperactive or very impulsive with their behaviors. So sometimes we can think about some of those things, especially associated with the hyperactivity, as being seen as disruptive. And one thing that we know about children with ADHD from research is that some of these behaviors that might be seen as disruptive to other children can lead directly to peer rejection. Children with ADHD are frequently at risk for being rejected by their peer group. And that can lead to, as one of the examples I gave about having trouble accessing the hidden curriculum, less practice with peers, less positive interactions with peers. And so they're not getting all the information or the quality of information about the hidden curriculum that some of their peers may be. Having a language impairment or a language disorder of any kind can certainly lead to social difficulties. Pragmatic use of language is what we call the social use of language. So that development of pragmatic language can be inhibited by the amount of expressive and receptive language. So how well you both use and understand language. If you have a hard time using language and understanding language, it inhibits your ability to have a real back and forth conversation or a complex conversation. Some children with language delays might appear to have less peer interest and approach, especially at younger ages when peer peers aren't really able to modify or change their behavior to help that child with the language delay have a successful interaction. I'm able to do that as an adult, but many of our peers are not able to do that as well. So again, they might experience rejection from peers who are less pro-social. And finally, talking about developmental delays and intellectual disability. Often we'll see these children as presenting as being very immature. They might have interests or play that are much more commensurate with a younger child. So keeping in mind that play is a really important part of social development for children. Not being able to share interests with your peers can be hindering. So think about, say, a 10-year-old child who is still very interested in, say, Blue's Clues, might have a hard time engaging with peers who kind of moved on from that interest. Their developmental and cognitive level in this diagnosis does significantly impact the ability to both absorb and retain the hidden curriculum. And so we might see that these children are interpreting actions or words of others in a very immature way. So again, not understanding nuances of conversations, not realizing that they're being bullied or teased, for example. And finally, thinking about our children who are anxious and those who specifically might have social anxiety. It's always important to ask the question is if the child has a true deficit in social skills. Often we'll see, and some of the current research suggests that children with social anxiety, and even some adults with social anxiety, at least a portion of them do not have a delay in social development, but rather they have a perception that they have a delay in social development, or that they perceive themselves to be incompetent in social interactions. That also can potentially lead to having less practice. We'll find as well that individuals with anxiety and social anxiety will tend to want to avoid situations that lead into increased anxiety for them. And what we know is that avoiding anxiety just feeds anxiety. So the more we avoid a situation that makes us anxious, the more likely it is that we are going to be more anxious the next time we encounter that situation. So what we'll see here is I've left something out on my previous comments on these diagnoses, is that we know there's a lot of overlap. So there might be some individuals on this call who have children or have been diagnosed with all of these conditions. And in addition, there's a lot of symptom overlap. So even if a child doesn't have a diagnosis of autism, they might have features of autism, and they might have anxiety or a language delay, even though they don't meet criteria specifically to clinical criteria for autism. So there's a lot of overlap. And to that end, I think it's important to note that the diagnosis itself is not always the most helpful predictor of what your child's problems are going to be. They might provide us with clues or predictions about what we think might be a concern for your child, but not necessarily definitive answers about why a behavior is happening. I think it's really important when we're doing targeted skill development that we're focusing on really individual symptoms rather than the diagnosis. And the reason for that is if you've met, one individual with a diagnosis, we often say this about autism, but it's true for many other conditions as well, that two people do not look the same, even though they have the same clinical diagnosis. Their presentation and their specific strengths and weaknesses might be very, very different. So when we're talking about skill building, we want to focus on where is your child right now and where do they need the most help. And one way to start thinking about that, and I'll switch over to talking about assessment here shortly, is just evaluate how adults and potentially even some same age peers are already accommodating your child. So we know that adults are likely to interact better with a child who has trouble with social skills, like I mentioned before, because they can change their behavior to accommodate that child's specific deficits. But let's talk a little bit directly about, okay, so we know your child maybe is struggling with social skills, but how can we assess where to go from here? What are the specific deficits and where do we go next? So there's a couple ways to go about it. The first is just asking for a direct assessment. This could be done by a range of professionals. It might be the child psychologist or school psychologist, the school counselor, or even a speech language pathologist who does direct testing on the social use of language. However, there are a variety of tools that sometimes can be useful, like theory of mind, which is an assessment on taking the perspective of others, social use of language, which would generally be conducted by a speech language pathologist. And then there are also some social skill packages out there as well, which provide both an assessment, which looks at skill deficits and skill needs, and then also provides suggestions for targeted behavior. It's important in all of this, especially during direct assessment, to consider your child's developmental and language level, because that's a little, again, an undercurrent among all of this is where they're at cognitively and where they're at with their speech language. You can also complete more informal observational assessment. I would do this in partnership with your child's school, if possible, to help identify what appropriate targets are. It's a good idea to try to get observations across a range of different environments. So in the classroom, where some of the interactions might be taking place, but also in less structured environments, like on the cafeteria or on the playground, as well as at home or in the community. Another way to do an observation is also to set up a structured play activity, like a board game where children can play together and you can observe how your child interacts, or your child's teacher could observe how they interact, to try to come up with some ideas about where skill building needs to happen. The focus of the observation should be on both the amount of social behaviors, but also the type. So taking note of how many, not just how many times your child perhaps makes a social bid or responds well to a social bid, but also, was that a positive thing that they did, or was it a negative behavior? And then also paying attention to how peers respond to the child. Ultimately, if done well, they can result in a chart that we call a sociogram. So let's say in this example, the child that we're interested in getting some information on is Lucy. And the arrows represent times that Lucy attempted to interact or respond to a bid from another child. And so what we can tell immediately right here is that Lucy is reaching out a lot. So she's reached out to James. She tried to initiate an interaction with Kayla, as well as with John, and as well as with Anne. But she doesn't seem to be getting a lot of responses. So if you're also taking data on what's going on, you would see that Lucy made a number of bids, but only 2 of them were quality social bids. So she reached out to Anne on one occasion, and it was she used a good skill. She's reached out to James, and it was a good skill, but all the others have been negative. So that's likely why she's not getting some responses. And also, although what we can also learn here is that she does occasionally have some positive skills. So it's not, we don't necessarily have to start with just how to say hi to a peer. We might just need to make that skill a little bit more consistent. So let's switch gears and spend the second half of our time today talking specifically about appropriate interventions. So the first thing, you've done some assessment, we've talked a little bit about diagnoses, but the next piece is trying to figure out what skills you're going to target. So what skill deficits are most significantly impacting the child's quality of social interactions could be a good place to start. If there is one behavior that they're engaging in that is really making them have a hard time interacting with others, or if they have a skill deficit that they're not introducing themselves to others at all. They don't know how to ask another child how to play. What skills are the most basic that we need to build on? That's another way to think about what appropriate target would be. Thinking about if there's any inappropriate skills that they're engaging in. So sometimes we'll see kids that will go up to other kids, and as opposed to saying hi, they will just take their toy, or they might engage in some sort of physical behavior as opposed to using words or saying hi. It's important to remember that behavior is communication, and we need to just help tweak their behavior a little bit and give them a way, in a pro-social way, to get what they would like. Another thing to note, as we mentioned a little bit with Lucy, is the skill present, but it's just inconsistent. So in this case, we might need to provide some instruction, but we also need to provide some practice or support for that child. And then again, as I've emphasized a little bit, don't forget or don't neglect to focus on appropriate play skills. If your child does not have appropriate play, it's very important in order to help them engage with other children to teach them appropriate play. Appropriate play is part of the hidden curriculum, and we want to make sure that we're not neglecting that in the grand scheme of social things, because they might be able to go up to another child and ask them to play, but if we haven't taught them to play, they might not know what to do next, or they might not do something appropriate next. Just a few things to remember before you start delving into some specific strategies. So first is to just get everyone on board with the plan and with what skills that you decided to target. So it's important to communicate with your child's teachers, their therapists, about what skills you're working on at any given time and how they can help best support that. In addition, asking therapists to support you and make sure that social goals are part of the therapeutic program. This can be really important for our children who've made lots of verbal progress, but that social piece is still lagging behind with conversation. Sometimes when kids are talking more, we'll say, okay, well, they don't need speech therapy anymore, but they could still need speech therapy, but it can just focus on the social use or the pragmatic use of language. Asking your speech therapist, as opposed to taking your child out for speech therapy if they're doing it during the school day, to push into their classroom so that they can support them in having positive interactions with peers, or including them in a speech group rather than doing one-on-one. And then also making sure that you're using reinforcers and rewards. Sometimes we think that social praise, or that, improved social engagement is going to be its own reward, that they're going to make a friend and that's going to be rewarding enough on its own that they will want to continue to engage in this pro-social behavior that we taught them. While that might ultimately be true, understanding the value of a social relationship for some of our kids who haven't had that experience sometimes takes time. It takes time to make friends, and sometimes we need to provide those reinforcers or rewards to acknowledge that they've gained a skill and they're doing a good job, and then promote that skill acquisition so they'll want to do it again. Just a few slides just about potential targets. So children who are chronologically or developmentally young children, some of the types of things we might think about working on are introducing themselves appropriately. And then the step beyond that is asking to play, but also how to respond to others when they're approached. Also learning how to take turns and managing emotions and frustrations. Older children and teens, this is when we need to start thinking about understanding friendship and relationship building, recognizing and naming a friend, identifying that there are different types of relationships, and then understanding appropriate behavior in context, which is that other piece of that definition about social skills that I think is important, is that context matters in social skills. And just one way to think about that is that the context of the other person matters. So is this person a member of your family? Is it a friend, a coworker, acquaintance, a stranger, or for our older children, is it a significant other? So how you interact with those different categories, it matters. And I would behave differently around my coworkers than I would around my friends. In addition, there's another layer, which is, where are you? Are you at home? Are you in a store? Are you in church? Are you at school? So I would definitely behave differently towards a stranger who I saw at church versus a stranger who came to my home. The way I would respond to that would be very different. And so trying to teach these levels of complexities is also important for our older kids. So one thing I encourage families to do and to think about is, if you do have a younger child, think about this now and think, how do I want my child to treat, say, the teacher when they get older? One thing I see happening sometimes is that when kids are young, they want to give everybody hugs and sit on laps, and it's really, really cute when they're little, and then they get older and we kind of have to unteach that behavior. And so just thinking about even for a child who's young, what is the appropriate social skill? What do we want them to know long term? In terms of specific interventions, formal social skills groups are a common intervention. So this type of intervention provides a combination of direct instruction as well as modeling of the skills and practice of the skills. It's good to embed typically developing peers. So peers who have good social engagement, it can be very helpful so that they can be good models. It is often done as part of a very specific stepwise curriculum, like learning how to read or learning how to write. So it may include a combination of skills that your child has mastered, ones that they can do inconsistently, so they haven't mastered them, but they know the skill, or skills that your child never does. And usually it would build on itself. Sometimes there's role playing with peers to give practice. Occasionally you'll see, samples where they'll also provide like a bad example and it's kind of funny, and they'll role play, well, how would you not do this based on what we just taught? I generally discourage having role playing with bad examples, because we're just encouraging them to engage in the behavior that we don't want them to. And then usually everybody laughs and they get a reaction because they just did something they weren't supposed to do. And we could be inadvertently reinforcing this social behavior that we don't actually want. There's also sort of informal or less structured social skills groups. So these sometimes are referred to as just like lunch bunches. So a small group of kids who get together and have lunch, or kind of planned play dates. The important thing to know is that this is a supported interaction. So we need to have an adult present who is both willing and able to assist with anything that's going on. So they might be suggesting things we could talk about, suggesting play activities, doing icebreakers. So this isn't just an independent play session with 2 kids or 3 kids. This is a small group where they're getting a little bit of support. So we would think about it as a very kind of naturalistic teaching. Social stories are another fairly common intervention. Many of you may have heard of these. They were originally developed really for children with autism, but they're very effective for children across a range of diagnoses, including anxiety, including ADHD, any diagnosis where a child might have trouble understanding a certain situation and how they're supposed to behave or react, and what they can expect in different situations. So a social story just helps describe what a situation will be like. They clarify, and they provide suggestions about appropriate behavior. They don't really tell the child what to do, but kind of provide gentle suggestions about this is what you could consider doing in this situation, and that being a pro-social skill. They're best used when they're provided well in advance and read every day. So sometimes these can be about a specific upcoming event, or it could be about just everyday social skills. So how do you greet your teacher in the morning? I would read that to that child every morning before they go to school until it gets to the point where it feels like they've mastered that skill. Anybody can write a social story, but parents, teachers, and staff, if you look up Carol Gray, who is the founder of Social Stories back in the late 80s, there are lots of examples online and lots of books about how to write social stories. Video modeling is another strategy. So in video modeling, we want to use a YouTube video to show the child what we want them to do. So if they're not engaging in the behavior at all, or we're having trouble with some of our other direct instruction strategies, using a visual and showing them this is what I'm asking you to do can be helpful. You can make your own videos, although there are libraries worth of videos online if you Google video modeling. If you do decide to make your own, try to use a child that has good social skills. So this could be that they are greeting another child, or they're asking another child to play, and we're videotaping that. There are lots of videos now online of appropriate play skills. And so you can make your own, but I think there's a wealth of how to play with toys appropriately on YouTube that many children watch now. And I find that families will often say that their child learned quite a bit from watching other children learn what other children play on YouTube. And then self-modeling can also be a useful tool. If the child does the behavior sometimes, and you can maybe support them and get them to do the behavior, then you can show them doing the behavior that you want. And keep in mind that a lot of social skills are kind of abstract concepts. And to the extent that we can change that concept to something abstract to something more concrete, visuals can be very helpful. So they are a powerful tool. And we use visuals so frequently. I would think about how we can use visuals to help with certain social skills and social development. So one concrete example is personal space. Anything that requires a child to stay in a certain spot, I encourage to actually if teachers put tape down on desks. Some children are really going to struggle sitting on the floor. And so if we have a chair for them, that might really help clarify the expectation for them. And so what are the barriers here? So one major barrier is that sometimes skills do not generalize to the regular environment. This is especially true when we use sort of the more artificial social skills interventions, which would be things like the formal social skills group, where we're only getting one practice in one context. The importance of kind of getting out of the classroom and practicing these skills in real world can be very critical. So going to a social skills group, unless that group is somehow supported by the parents, by the teachers, by everybody outside of the group, often we can see that they might be able to do all these skills if they're at their social skills group, but they never do them when they're outside of their social skills group. So when they don't have somebody there telling them specifically what they should do, they won't do it. So we need to have everybody on board, like I mentioned earlier, to make sure that we're telling the child what they should be doing. It can be hard, though, to withdraw that adult support and adult supervision. So trying to make sure that we continue that support until the child has reached mastery and we're moving on to harder and harder skills. Fading reinforcements can also be hard. So if those friendships are not developing or they're not getting that same motivation from just the sheer friendship development or social interaction, fading out reinforcements can be difficult, and it should be done very slowly either way. If your child's engaging in a lot of maladaptive behaviors currently that are interfering with their pro-social behaviors, sometimes those maladaptive behaviors are very well established and it's hard to replace them. So in that case, I would definitely increase your amount of reinforcement, and sometimes we really just need to hang in there with continuing our good behavioral strategies. And again, as we've kind of talked about a bunch, being consistent across environments that really everybody in the child's life is working towards supporting these new skills. And that brings me to the end of my talk today, and I look forward to answering questions with you for the next few minutes. Thank you.
Welcome, everyone, to the Developing Social and Pragmatic Skills in School-Age Children Q&A. My name is Kaitlyn Singer. I'm a project manager for Simon Searchlight, and I'm joined today with Dr. Cora Taylor. She's a pediatric psychologist and an assistant professor at Geisinger's Autism and Developmental Medicine Institute. She's also PI on Simon Searchlight. We're excited to get started with the Q&A session and to address some of your questions. A quick note for everyone listening, you should be able to see and hear me on your screen, but I won't be able to see or hear you. We welcome you to ask questions in the Q&A box. Please remember to avoid including personal health information in your questions for your own privacy. We apologize in advance if we do not get to your questions. We'll try to cover as many as possible. Since there are so many genetic groups represented, it may be difficult to answer very specific questions. With all that said, let's start the Q&A and hear from you all. Let's begin with a question from an attendee. All right. My child struggles with social interactions. I was told he doesn't have autism, but I still think he does. Should I get him reevaluated or just work with him to get him to do better socially?
That's a great question. So I would recommend that you do both. Depending on when your child had that first evaluation, the younger the child is, the harder it might be to make a really definitive diagnosis of autism, especially if they only have mild features of autism. So it's definitely worth going back. You can go back to the same provider and ask them to reevaluate your child that you would like another evaluation. You could also potentially think about seeking out a different provider rather than going back to the same provider, so that you truly get kind of a second set of eyes on your child. Sometimes different providers go about the evaluation different ways, and if you really want a thorough evaluation, you could find somebody who will do a longer evaluation. Often a high quality autism evaluation will last at least several hours and can last longer, especially with older children, and should include an extended developmental history interview, as well as some direct testing with the child. So it shouldn't include only an interview or only direct testing with the child. It should include both. So those are some things to look for when you're looking for a provider to give you a high quality autism evaluation and kind of put everything together for you. And then in terms of working with them, I would just go ahead and start working with them. Really, we don't want necessarily the diagnosis alone to drive the treatment. We want the child's symptoms to drive the treatment.
All right, great. Thank you, Cora. For the next question, My therapist and I have practiced skills with my child over and over. So I know he can do some of these good social things, but he doesn't use them when he should on his own. How can I help with this?
So what you're getting at here is something I don't think I covered very much, which is social motivation, which is something that some of our kids do struggle with. So it's they might absolutely have the skills, but are not necessarily very socially motivated. Many of our children are socially motivated, and it's a bit of a myth to say that children with autism or children with certain conditions are not, motivated to have interactions or don't want to interact with others socially. But there are some children, and I would consider them to be some of the most difficult to work with on social development, is because that motivation is not present. So sometimes though, if you can get them motivated, they might start to realize that they do enjoy social interaction. So it might be that we actually start by giving them some kind of like a reinforcer or motivator for engaging in a social interaction for a period of time, because that building of relationships might be a helpful, might come along, but if they never engage in the behavior, it's not going to happen. Sometimes we do have to start with reinforcing it and then slowly fade those reinforcers out.
All right, we have another great question that came in. How can I help my child who's being rejected and bullied by their peers?
That's a really good question, and that's a hard one as well. So one of the things that we know, and I think I covered this as well in my presentation, is that some of our children, especially those who have ADHD, are at risk for peer rejection. Some of their behaviors might be off-putting to other children for whatever reason. So the first thing I would do is try to work on some of those behaviors. A big one is just personal space, and sometimes impulsivity. So like very quickly taking another child's toy might be something that we see children with ADHD might be likely to do. So we'll just want to be cautious about what behaviors might be driving some of the social rejection or the bullying behaviors. And then also, I think if this is happening at school, I think talking to the school system about implementing a positive behavior support plan. Often we think of these interventions as being classroom wide, so they don't just target one child, they target the whole classroom or sometimes even the whole school, to help support kids who have been bullied or rejected, and also help kids have more positive interactions with each other overall. And I think last but not least, the social skill of what to do if someone's bullying you. How do you respond to that? And recognizing when you're being bullied is a skill that some of our children may struggle with, and definitely we might need to work on that with some kids.
All right, great. Next question. My child is homeschooled and I can't find any programs to enroll her in to work on social skills. What should I be doing at home?
Great question. So don't give up. First, I would say on finding a program, continue to look, because new providers definitely pop up a lot frequently. So keep looking for a provider. Sometimes they're also seasonal. So because of sports and school and lots of other things going on, often we'll see that social skills groups are run during the summer. So if it's during the school year, right now you might think about looking again during the summer to see if anything is popping up. If there truly are no programs and still nothing, the first thing I would do is start to think about organizing play dates yourself. This could be with a preferred peer or a small group of peers, depending on what types of skills you want to work on with your child. Really, it's about making sure that your child has adequate chances to interact with other children. And then you can also build in sort of not a structured play activities. You're not necessarily telling them what to do, but trying to get them to engage in, say, like a board game. So where they have to interact as part of the play that you're setting up. And then you can be there to support your child if things get challenging, but you're prepared to do that and you've carved out time to do it.
All right. Next question. My child is overly social and has no stranger danger, and I'm worried about safety. Do you have any suggestions?
Yeah, that's something that we definitely need to work on with very young children. So if your child is overly social now and they're a young child, I would start right now, regardless of whether or not sometimes that overly social behavior seems to be kind of appropriate or seems acceptable at sometimes. So we think about children who are maybe age 4 or 5, it can kind of be cute. They might run up and hug their teachers and things like that. That gets a lot less cute when children are about 12 or 15 or 18 or 20. So I would encourage, if you have a child with a disability, to start encouraging them now to engage in appropriate interactions with others, even if others think it's cute, and talk to their teachers directly about encouraging appropriate greetings even to the teacher. And then making sure you're teaching about the difference between public and private behaviors is another way to keep your child safe. And having those, I think in the presentation we talked a little bit about putting people into categories and going through what's appropriate with each of these, individuals. So that's where I would start there.
All right, thanks, Cora. All right, next question. How come many children with genetic conditions are so absolutely sweet and kind to others?
We do have some genetic conditions, and I would love to say that all of our children with genetic conditions are sweet and kind to others. There are some genetic conditions that are associated with certain almost personality traits, and I love the question. I don't know I don't know how to answer the question, but we do know that happens sometimes, and it's just another feature, and they make us, and it makes them very special in our lives for sure.